Restylane.
Yeah.
I had my lips and the lines around here. Is that the only area that you use Restylane for, or do you use it as filler for any other portion on the
Restylane
face?
is actually beginning to, the indications are expanding tremendously. Probably one of the most popular areas to use it is around the lips and the folds in this area here that on the term the nasolabial fold or the cheek folds. Nowadays, people are using it to fill in areas around the eyes.
Interesting.
Filling it into these sulcuses here, around the outer parts of the lip, foreheads, different areas that add volume, and that brings us into a whole new paradigm in facial rejuvenation. And that's the thought that it's not just that the skin is sagging or that the tissues are dropping, but part of it is that the underlying tissue, the fat and the muscles, are actually losing their volume. And when they lose their volume, the face begins to deflate. It has a deflated look, a thin, sort of gaunt look.
Yes.
And that around the cheeks, around the eyes, the sockets, and that's becoming we're becoming much more aware of that nowadays, and doing things to try to restore that volume. Things such as fat injections. It's a very popular thing. And there's also a group of fillers, one of them is very popular, called Sculpture, which actually thickens the skin and enhances the volume in that area.
Wow, how long does that last?
Sculpture is interesting in that it's not a particulate filler such as like Restylane, where you fill it and you see the effect you get. It's thought to enhance or increase the process that thickens the skin. So what you do is you inject it into underneath the skin, and then you do it again in, say, for example, 6 weeks. And in between the first time you inject and the 6 week mark, there's very little difference. Then you do it again in 6 weeks later, and by the third or even sometimes the fourth injection, you start to see an expansion in the thickness of the skin. And once that occurs, that change lasts roughly 2 years. But the nice thing about it is you never go back to where you were on day one. When you have to reintroduce it at, say, for example, 2 years, you simply just do a touch-up. Your skin is already thicker than it was before, and the volume is maintained. It's just if you lose a little, you add a little bit. So it's a nice thing, and it's a sort of a semi-permanent solution to that problem.
Now, would that help on people who have had, say, acne problems, scars? Would that help fill that?
For scars, it may efface certain types of scars. It might, though I'm not sure on that. If it would be a great indication for that. But in general, those type of things are better for resurfacing type of modalities. Although you can, for example, put a little Restylane underneath a scar to help elevate it. But again, it's a short-term solution. More long-term solutions are either laser resurfacing or chemical peeling, or in some cases when you have very deep scars, you would have to actually excise them or do different surgical techniques in order to help that problem.
And I want to talk about that on resurfacing. Also, I know that you will be doing IPL come July at UCI, and talk to our viewers about the photo rejuvenation that you'll be doing, also the chemical rejuvenation, all of that, and what the effects do and how long they last. And I know a lot of people want to know about this, and they don't know much about it. Well,
again, it goes back to the whole sort of paradigm of aging. Aging is happening on multiple levels. The skin is becoming less elastic. It's becoming, the collagen is decreasing, it becomes thinner, and it begins to sag. Wrinkles occur. Also, you get discolorations in the skin because of years of sun exposure. Also, underneath it, again, we talked about the volume loss, and then we talked about the tissue that actually loses its position, and you end up needing, for example, a facelift or other things. So it's happening on multiple levels, the aging process, and they're all happening at the same time. So in order to really rejuvenate somebody, you have to look at it on each one of these aspects separately and find out which part is contributing to the aged appearance, and then formulate a treatment plan that addresses that. And sometimes you have to do 2 or 3 different procedures, and sometimes 1. Now back to your question about skin. There's 3 mechanisms in which you can resurface the skin. One is mechanical, which in the form of a dermabrader, which is conceptually just like you're sanding the skin down, you're filing it down and allowing the deeper segments to reestablish a new surface. You can also do the same thing with the use of a laser. Laser is simply a more sophisticated tool for that. It gives you a little bit more control, but it heats the skin and it causes the skin the surfaces to slough off, and it allows the deeper stuff to come forward.
Okay.
In a formal sense. And then there's chemical peeling, which does the same thing as a laser, but using chemicals. Now, a very new and sort of popular modality is these non-invasive or non-ablative technologies that use light, for example, IPL. In those cases, what you're doing is you're going in for multiple treatments. You're exposing the skin to intense light. And the thought is it changes the skin in several ways. It potentially can thicken the skin in some cases, but also in the hyperpigmentations or the changes in color, the increase in vascularity, the small vessels and things like that you see and oftentimes in aged skin. It treats those, and it improves the skin texture and skin quality. The downside is you have to use multiple treatments. The nice thing about it is that there's very little or no downtime to it. And at UCI at this point, in our department we haven't had one, and hopefully during this next year we're going to be making some arrangements and being able to offer that service.
Yes, I think IPL is wonderful. I've had actually 2 procedures done, and at first you're a little bit taken back because it does bring out, if women have used birth control or what have you, and they have what's called the brown spots, it brings them out, and at first you're a little bit concerned, thinking, oh my gosh, this is going to go away. That typically happens though, right? And then it actually sloughs off?
It can, but you have to also look at what exactly is the cause of those brown spots and what they are. And everyone has a different sort of mixture of skin types and skin findings, and so sometimes you have to use a different type of a laser or go back to a deeper chemical peel to get rid of those deeper hyperpigmentations. So it all sort of depends. And the way to look at this is there's no one magic bullet, and there's not any of these that unfortunately, that's right. And there's nothing that will take care of everything in one shot. So the best thing is to to look at everything and pick and choose the modalities that are going to be able to get you the results, and recognize that if anyone is offering you a single option, many times you're going to fall short on one aspect of it or another.
And I also, before we actually started taping today, we were talking about new cosmetic procedures that are being done where you do threading. If people need an eyebrow lift, I don't know if you want to talk and tell our viewers about that.
Sure.
That would be great, please.
The overall trend again in cosmetics right now is moving away from more invasive operations. There's certainly a place for them, and they will never go away, because nothing can do what a surgical facelift can do or a brow lift can do when it's indicated. But what we're seeing is, because of the expansion in the sort of popularity of plastic surgery, younger and younger patients are coming, more and more people are coming, people that may not be good candidates for these open procedures, the more complex surgical options. So the in-between of that is this group of surgeries such as like the thread lift, and what that does is it simply uses a non-absorbable, and what will potentially be in the next few months come out with an absorbable system of threads that simply, for example, in the case of the brow, you make a small incision out here and you place these threads into the skin on both sides, and then what we term undermining the skin or elevating the skin and pulling the skin up and allowing the skin to reset into its higher position, and up with it comes the brow. And the same thing can be done in the mid-face here, where a lot of people begin to lose volume, and the position of this fat pad will begin to drop. You can reposition that up there, and as well as the face and the neck. The nice thing about it is it's done essentially without any serious anesthesia. It can be done with just taking some Vicodin or some type of pain medicine or an analgesic or a anxiolytic before, and done under local in the office.
Wow.
Yeah, but the downside again is it's less powerful, so the long-term aspects of it may not be as ideal. It's again not a magic bullet, but it certainly will get you through periods of time that may be important.
Okay.